Thank you for joining us. I'm Mary Yanez, Director of the Senior Adult Program here at the El Paso Community College. And of course, this is Mature Living, the show that educates us, actually, reaching out to families in the community, seniors. And today's topic is going to be about pain and the different treatments and therapies. And so we've invited Dr. Raul J Lopez, who is with the West Texas Pain Institute here in El Paso, and to just explain to us a little bit about pain and how to manage pain and how it can be managed, but also to learn a little bit about himself as well and know about the other doctors at the Institute. Thank you for joining us, Doctor.
Thank you for having me.
Tell me a little bit about yourself. You know, people
Sure.
always like to know who we are interviewing and where you studied and things like that.
Sure, of course. So, as you mentioned, I'm Raul Jose Lopez, originally born and raised from El Paso, Texas. I grew up in the Bel Air area, but I went to Eastwood, so I'm a trooper.
Okay, yeah.
From there, I applied to undergrad, and I left for that at the University of Texas in Austin. So I spent 4 years there, and I majored in biology, got my bachelor's of science in biology. And, after that, I applied to medical school, and I got into a school in Ohio, the Ohio State University College of Medicine and Public Health.
Wow.
So I spent 4.5 years out there getting my medical education, and after that you apply for residency, and I landed a spot in Los Angeles, California at the Cedars-Sinai Medical Center, where I got my specialty in anesthesiology and fellowship training in interventional pain management. So
very interesting. And how it brought you back to El Paso?
You know, it's quite interesting. My grandmother was getting sick at the time, suffered from chronic pain, so that was part of the reason I wanted to get into pain management. And
really?
She was seeing one of the local pain doctors here, so throughout the time she was visiting him, I would go to the treatments and see her participate in with Dr. Carlos Viesca. So he kind of mentored me and said, hey, this is a great field for you to come back. We have a lot of people who need help, and that's kind of what brought me back. So. And
it's so important because the misuse of pain medicine is also very important. But let's talk a little bit about the treatments
Sure.
that you want to talk about.
Sure.
The kyphoplasty, what is that?
So, at the West Texas Pain Institute, we treat pretty much chronic pain, acute pain, everything from head to toe, headaches down to feet pain. And unfortunately, as we age, our bones can become brittle. That's known as osteoporosis. So as your bones become brittle, they become weak, particularly the ones in the back, they can fracture. So if you have a slip and a fall, if you fracture your back, the only treatment is going to be conservative up to kyphoplasty. So what that is essentially, we're fixing the fracture with bone cement to keep it from fracturing more and hurting the patient more.
Wow, that is amazing. Most of these words I can't pronounce.
Yes, it's okay. I can help you with it.
Yeah. But this one, a radio frequency ablation, and that's also for back pain?
Correct. So, and there are some patients that, again, they're either senior citizens or young patients who want to opt out of surgery or not candidates for surgery who suffer from chronic low back pain. So this is a service that we offer to those patients. So after they've gone through a series of what we call blocks for the lower back, they get at least anywhere from 50 to 80% pain relief. To prolong that relief, we do what's called a radio frequency ablation, where we desensitize or cauterize a sensory nerve that controls the arthritis in the back.
Wow.
So they get prolonged pain relief.
And many of us have to go to our primary doctor.
Mm-hmm.
Do most of our insurances pay for some of these treatments?
I would say the majority of insurances do pay for them, but in some cases, the primary care doctors do have to refer the patient to us.
We need referrals.
Correct.
Absolutely. Fibromyalgia.
Fibromyalgia.
You see?
That's a challenging one to pronounce and also to treat as well. A lot of patients who complain of whole body pain, everything hurts, head to toe. Their hair can hurt, their eyebrows, even the eyelashes, and they feel like nobody is listening to them. Nobody believes that they have pain, and these are some of the treatments that we can help patients with in our clinic to treat that fibromyalgia pain.
Yes. And then we have another one.
Neuropathy.
Neuropathy.
Yes, neuropathy.
I have the accent in the wrong place.
No, that's okay. Neuropathy.
Neuropathy.
It's a pretty common condition in patients that have either diabetes or they suffer from thyroid issues to develop what's called diabetic neuropathy, hypothyroid neuropathy, or even idiopathic neuropathy, pain in the nerves, essentially, is what it means.
Yes.
In the hands, in the soles of our feet, in the legs, and they describe it as burning pain. So we don't want our patients to have to suffer or live through this. So these are some of the things that we can treat at
And are these
facility.
treatments sometimes short-term or long-term or both?
And it's all over the place, but you're correct. Some are short-term treatments and some are long-term treatments. Some of the short-term treatments, what we're trying to do is buy the patient time until he's able to get in to see the surgeon who may be able to help and fix and remedy the situation.
So discomfort, there's pain is so, they call it discomfort, and I don't really like that word. It's pain, it hurts.
You know, everybody suffers through it at one point in their life, and we're here to help our patients through
Yes.
it. So.
The use of pain medicine through prescription drugs, how can you help us to be aware and how to take care of that and not to abuse it?
I think there are so many programs now involved that are there to help mitigate these risk factors. Of course, you know, it starts with your doctors, primary doctor, specialists like ourselves, interventional pain doctors, and of course, the pharmacies that are dispensing these medications to provide proper instructions to the patients from day one, showing them that this is a short-term, you know, treatment for as needed pain relief, you know,
Yes.
not long-term relief. So
Yes, and of course they call them the abuse of opioids and the
Yes.
problems that arise from the abuse of taking these pain medicine. We've gone through those things pretty fast, but I know you have some success stories of some of your patients, and of course you're bilingual.
Correct,
And
yeah.
your doctors, tell me a little bit about that. Your doctors there at the...
So right now at West Texas Pain Institute, it's consisting of 5 providers. Myself, Dr. Kendrick Thomas, Dr. William Leon. Dr. William Leon is an interventional pain specialist with a background in rehab medicine. So he has an added effect of doing rehab medicine for some of our patients. Dr. Kendrick Thomas is also an interventional pain specialist, but his background is in anesthesiology, similar to mine.
Yes.
And we have 2 nurse practitioners, Eva Ramirez and Gabriela Martinez, who also help and assist in taking care of our patients. They have so many years of experience, actually more than probably some of the providers, some of the MDs that practice there.
The younger ones.
Yes.
But you know what? We need you. You left El Paso to study medicine and you came back. And I think we love that about you. And because of your grandma, I believe
that's what brought me back. You know, I want to say she was a big part in raising me growing up, and you know, she did play a big role in my life. So part of my inspiration to become a doctor and even to treat pain management was her. So, you know, I was gone 14, 15 years. I can't count anymore. And after, you know, I was finished with my residency, fellowship rather, I came back, and unfortunately, she passed away when I completed my residency, but you know, I was not able to help her with that. But you know, at least I can continue to help others, you know, who are in similar situations.
Our senior adult program serves the elders 55 years and older. Our classes are free, by the way. They don't have a tuition attached to taking the class. They just have to be 55 years and older. I think that's a youngster to me.
That's a youngster, because majority of our patients are above 65.
Exactly.
You know.
So any success stories that you could share in general?
Sure. You know, we like to kind of, and a lot of our patients will leave feedback, personal feedback, or even, nowadays everything's online. Google reviews is what everybody calls them now, right?
Yes.
And a lot of those success stories are on there. They can read the reviews there. But I like to hear when a patient comes in and you see them from day one. I'll give you an example. A lady came in to me, and I think she was about 65 years of age, and she was suffering from what we call post-herpetic neuralgia. So talking about those nerves. So shingles, when we're kids, we have the chicken pox, and
Yes.
that virus can actually stay dormant in our spinal cord. As we age, there are certain risk factors that can have that virus come out and cause these really bad, shingles or vesicles is what we call them.
Yes.
So a lot of people suffer from the acute pain, but then the chronic pain that it can leave when it causes those nerves to burn. So we had that lady come in, we assessed her, and she was a great candidate for what we call an interlaminar epidural injection. So we did an epidural along those nerves that control that pain, and she had really, really good success with that. I mean, it was from it was a complete 180 essentially. She came into me, and 7 days later she was like, "Wow, thank you so much for turning my life around and helping me with this pain."
Because I understand it's really paralyzing. You can't do anything. You can't dress. Even the clothing that you put on rubs, and it hurts.
Yeah, and some of the treatments, unfortunately, there's a chili powder treatment we call capsaicin that it burns more, so you're supposed to mask the pain. So it's not a very pleasant treatment, but there are a lot of treatments. So I was just glad to hear that she got that relief. And it's interesting to see a patient when they walk in a lot of pain. They don't want to smile. They don't want to talk to you much because they're in pain. They're suffering. And then a week, 2 weeks later, you see a completely different person. So we have a lot of those patients.
That is so good. Very gratifying, I'm sure.
Very gratifying for sure.
all of you there.
Yes, correct.
And thanking you for being here. I do want to ask you if you would tell us where the locations are and maybe a phone number people can call. They might have some more questions. Maybe they have a mom or a dad or themselves are going through some pain, and with all these new technologies and treatments, there's help.
Yeah, we do. Thankfully, we have 3 convenient locations. We have one that's located right across from Del Sol Medical Center. We call it our East Central location. We have one right behind UTEP, right behind Las Palmas Medical Center on 125 Hague Road. And we have a new one that's going to be opening up in March on the northeast part of El Paso on McCombs area.
Gosh.
So I believe there are 3 convenient locations to help our community so that they can get there. A lot of our patients can't drive, or somebody has to drive them.
Exactly.
So it makes it more convenient to have accessibility to these locations.
That is so good. And
our phone number is pretty easy to memorize, 915-313-4443. Even I can memorize it.
Yes, that's an easy number, 915-313-4443.
Pretty easy.
So I even have some questions that I might call and ask about because of arthritis. Can you touch just a little bit on that?
So our arthritis is very, very common, particularly in the elderly, and we team up with a lot of the doctors in town, rheumatologists, internal medicine, and of course ourselves. The rheumatologists play a very, very big role in helping to treat arthritis with certain medications, and where we come in is we can inject some of the arthritic areas with pain medication, lubricant jellies that lubricate those arthritic areas. For example, patients that prior to a knee replacement, they go through steps of treatment. One of those are knee injections, with steroid, with lubricant jellies to help lubricate the bone so we don't have that bone on bone that we keep hearing about.
Oh my God, that caused to get a knee replacement eventually.
Correct. So, and of course there is medication management, not having to do with any opioids or opioid-related medication for it, but a lot of very strong anti-inflammatories that can help with the inflammation that goes along with arthritis.
So I'm sure you have to keep up with a lot of new treatments.
Hey, we do. That's why we got to keep going to these courses, CMEs, and everybody does it. So.
Very good. Well, thank you for taking time. I know you're
Thank you for having me.
in your work clothes right now.
I'm ready to go back to work right now and help patients with interventional procedures for pain. So that's why I came in this.
But we've been talking with Dr. Raul L. Lopez from the West Texas Pain Institute and educating us. And that's why we invite you all to come and talk to us, to educate us about the new therapies, things we can do for ourselves, and how to take care of ourselves better and not have so much discomfort. I'll use that word again, discomfort.
I like that word.
Okay. And so we'll be back with more guests here on Mature Living. We thank the West Texas Institute and Dr. Lopez for being here and for coming back to El Paso, right?
Thank you for having me.
We'll be back. Thank you. Thank you for joining us. I'm Mary Yanez, Director of the Senior Adult Program You're at the El Paso Community College, and as you know, we have wonderful classes offered every semester, 3 semesters a year. They are free, tuition free. All you have to be is 55 years and older. So you be sure and call us at 915-831-7801. And I had to get that in there because we're also looking for volunteers, as is Yesenia Perez, who is the manager of the volunteer services for University Medical.
Yes.
Thank you for being here.
Thank you so much for having me.
I know I've met you before. You know, where have you been recruiting? And tell us a little bit about yourself as well.
So I'm with a University Medical Center, and part of my job is community outreach, and that's going to events like yours, the one that you hosted in Christmas, the Love Conference recently. And basically it's to recruiting volunteers and spreading the word that UMC is open. So basically before the pandemic, we had over 200 volunteers coming to the hospital helping us out. Pandemic came and they shut down that department, obviously for the reasons that, you know, nobody could really go in there safely.
And we did the same thing.
Yes, it was just an ugly time for us, but now thankfully we're going back to post-pandemic times, but that means that we need volunteers again.
Okay.
So part of my job is to do outreach and just remind everybody in El Paso that we're open, that we're recruiting volunteers, that we need the help. So I'm doing the outreach, inviting people to come back to the hospital, and you know, they get to create their own schedule. They get to tell me where they go. They get lunch on us, and I need to admit the food is rather good. So they get delicious lunch on us. So that's where we met. We met at one of your conferences. Yes.
Wonderful. And I want to ask you, going to these community events, has that helped? Give me the example of
it definitely has helped. So for example, in the Love Conference, you know, there was 2 friends that came together. I'm telling them about the program, and there was 2 amiguitas that came, and basically the conversation was right in front of me. If you go, I'll go with you. So they're like, okay. So then we started talking about what they would want to do. So they're going to interview together. They're going to volunteer together. They're basically going to do the whole process together. And that's definitely one thing that they have the option of doing. Now, another program that I oversee is pastoral care, which is a ministry where they go and pray with the patients. So I have a pair of another amiguitas. One of them plays the guitar, the other one sings. So they go and they pray with the patients, they sing for the patients that are in need, and they just provide that spiritual care for our patients,
bringing joy to the patients.
Exactly, bringing
the
that
buddy
joy.
teams.
Exactly.
I like that, buddy teams.
Yeah,
you know,
that's going to be my next marketing.
That's it. We'll call them the volunteer buddies. That's a wonderful idea because they can carpool, and it's part of socializing and being together, a support group for each other.
Exactly.
Having fun.
Exactly.
So when they go into into a volunteer assignment, is fun part of it?
Exactly. That's honestly the one thing that we stress. We want it to be fun. So part of the interview is me finding out, what do you want to do? I don't want to dictate what they're going to do. I don't want to say, you know what, I want to place you in this department. I want you to do this. No. I want you to tell me what you want to do. And funny you say it, in the Love Conference, one of the ladies said, no, not the hospital. I don't want to see blood.
Exactly. I was going to say that some people don't even want to see a hospital after COVID and all that. They just don't have good
And I keep telling her, I'm like,
vibes.
no, you're not going to see blood. And interestingly enough, one of my current volunteers was also at the Love Conference, and she was there, and I called her over and I said, come over here, talk to her. And I said, tell me, how long have you been volunteering? She said, about 2 months. And I said, how many times have you seen blood? And she looks at her, she's like, I've never seen blood. I'm like, I know, because you're doing administrative work. So that kind of eased her into it, and you know, she's scheduled for an interview. So going back to say that we'll have the interview, if they want to be in patient care departments, pass out water, pass out meals.
How about greeters?
Exactly. Greeters.
Information, booth.
Exactly. Giving the passes for the visitors, walking them to the floors that, that where they have their appointments, being in the patient care areas, just filing. There's some people that have the background in administrative care, and they want to file and be in an office setting and answer phones. They're more than welcome to do that as well. Yes. So basically, the way that I like to explain it, the hospital belongs to us. So go be a part of it, enjoy it. If I do place you in a department that you say, you know what, maybe it wasn't the best fit for me, it's okay. Nothing is written in stone. We talk about it. We change the department. We just want you to enjoy every single minute that you're in the hospital.
So wonderful. And it's difficult sometimes to schedule volunteers because we want to go by our schedule or by our needs, the organization, and it can't be that way. We've got to put them whenever they're. Why do people volunteer? Have they told you some of the reasons?
So most of them, 99% of them, because they want to give back. And they have that giving heart. And that's one of the reasons why I like to do the interviews. I want to make sure that they're doing it for the right reasons. It's not to check off a box. It's not because I just want to have hours. And no, I want to make sure that they're doing it because they want to give back, because they're caring. I'll tell you a story. I have a retired licensed vocational nurse, and she came to interview, and I asked her, why do you want to volunteer? And she said, I'm going to be very honest with you. I've been retired for 2 months. I'm at home and all I do is fight with my husband. So I need to do something different. I said, you know what? Come and volunteer with me.
And the men say, all I've been doing is honeydews and I'm not doing it right.
Exactly.
And I get yelled at.
Exactly.
So maybe I should go out and get out of the house.
Exactly. So I do couples counseling as well.
Whatever the reasons are. Maybe they went to your hospital, to the University Medical, it used to be called Thomason, right? Mm-hmm. many years ago, and maybe they loved the way they were treated, or they saved a life, you know, and so they want to give back to the hospital.
Yes, ma'am.
You know, medical people are so special, and we learned that more and more during COVID. Mm-hmm. Dedication, burnout. I mean, they were there 14 hours, or you know, and just almost living in the hospital.
Right.
So giving back as a volunteer to a hospital, it's just a very beautiful way and meaningful way to spend your time.
Exactly. It's a very unique experience. Every day is going to be different. You get to meet, you know, all kinds of different people. You get to meet the brand new dad who's excited, who's ecstatic, and he just wants to tell the whole world that he just became a dad, the brand new grandma as well. But on the other side of the coin, you get to meet that family who has a relative who's not doing so well, who you see that heaviness in their heart, you see that heaviness on them. So we need to have that compassion, that empathy, that go that extra bit of you know, that extra mile for them. They need that patient escort. They need somebody to walk them to that department. They need somebody to walk them to that cafeteria, because even if it's just 2 directions to get there, they're not going to remember what you said because their mind has so many things there, and that's where my volunteers come in. We had a gentleman recently, and all he spoke was Russian, so we needed to get a translator, and I mean, there's a whole process behind it. But my volunteers stayed with him from the moment he arrived to the hospital to the moment that we answered all his questions and he left. And this was after his shift. He took his own time to just stay there and speak with him. And the gentleman kept using his phone and using Google Translate to say, thank this gentleman, and just tell him I'm so grateful for him. Thank this gentleman. And he was just so thankful for my volunteer to stay there. I think he stayed there an extra hour and a half just to assist this patient. Oh, I mean, that goes beyond words.
Exactly. Mm-hmm. How grateful we need to be to volunteers who save our industries and our organizations millions of dollars of time that they commit to. So there's some commitment requirement, but then there's also an application process.
Yes. So for the application, everything is online now. So they would go to our website, which is www.umcelpaso.org. Under patients and visitors, they'll see volunteer. It'll give them a little bit more information about the program. They'll go to adult volunteers, and then they could apply through the website. Now, if it's too much technology, all they could do is just call me at 915-521-7648. I could schedule them for an interview and we could do everything in person.
And you can do it bilingually, Yesenia?
Oh, yes, of course. Mi primer lenguaje es español. Pero después se me olvidó, so now I'm kind of bilingual in both. So I do a lot of Spanglish, but I could still carry a conversation.
when my Spanish, I don't remember a word in Spanish, I say it in English.
Oh, yes. Uh-huh.
And then I sign and try to speak and to be understood. It's what's important.
Yes, ma'am.
So the application process, do you do background checks and things like that?
So we'll do a background check. We'll make sure that all of our volunteers go through our process of occupational health, and that's make sure that they have their flu shots, COVID shots, their MMR, and that's because I want to make sure that they're protected, because while we're in a hospital setting, there's going to be patients that have different illnesses. So before I place anybody in the hospital, I want to make sure that they're safe. So that process takes about 2 weeks. They'll need to go through an orientation with me as well, where I tell them everything about the hospital. In case you hear this code, what does it mean? In case you hear this, what does that mean? So they'll get a nice, overview of the hospital.
Have you had volunteers? And I think I met a lady one year that had been working as a volunteering, had been volunteering for the hospital for many, many years. So do you have some 15, 20-year-old, 20-year that had gone?
We have several, and we go by hours, and I think, if I remember correctly, he was reaching over the 8,000 hours of service. We have several. We're actually going to have a banquet in April, and we're going to call back some of our volunteers to recognize them, because really what happened with COVID is the program shut down, and we were not able to acknowledge all those volunteers who invested tons of years and their time in the hospital. So we're going to bring them back to acknowledge them.
Yeah, to recognize them. That's
wonderful. But we
wonderful.
have so many people. I have this gentleman that was helping me with this patient who only spoke Russian. He's there probably more than I am. He's there from 6 in the morning to 3 o'clock every day, Monday through Friday. We literally have to tell him, hey, as a volunteer, you could only be here 40 hours a week. You need to go. You really need to leave the hospital. But he loves it there. So everybody in the hospital knows him. He's just amazing.
That is so good to know. This was a great interview. I really enjoyed it. I hope that all of our organizations, including our senior adult program, we're always looking for volunteers to help us with conferences, the Love Conference, the Christmas celebration, Navidad on the Border, Grandparents' Day we celebrate. We're always looking for volunteers, even if they just come for the event and help us out. But we also need help in the office as well. So we wish you well. I'm going to have to memorize this number, 915-521-7648. Yesenia Perez, of course, the manager of volunteer services for University Medical. We thank you for being with us.
Thank you so much.
Any last thing that I didn't ask that maybe you want to mention? That it's really important that you wanted to mention.
Just as a reminder, they get to create their own schedule. They basically tell me when they want to come, where they want to volunteer. They get free lunch. They basically deal with me. So basically, if they need to be off for a few days, they need to go out of town. I've had those. My daughter's taking me to Houston for 2 or 3 weeks. I need to be off. It's okay. Go spend time with your family. We will need to make sure we have that flexibility in our schedule, spend time with their families as well. So there's going to be, we're not going to get upset because they need to spend that time with their families. So the flexibility is there. They would be dealing with me personally. So, I mean, everybody's welcome. I'm here to help them out. I'm here to be as flexible as I could possibly be with them. So just any questions, even if they have just one little doubt of maybe this might be for me, maybe it's not, just call me and we could have that conversation.
Mary, and you know what? I'd like to be invited to your volunteer training.
Of course.
Because we don't have a formal volunteer training program or process. And I would love to learn from you, and me and my staff might want to come just to watch you,
Of course, you're more than welcome. Yes, you're more than welcome.
And then we learn how to manage volunteers, how to treat volunteers, why they come back, reasons they come back over and over, and reasons why they don't.
Right, exactly.
But absolutely, Yesenia Perez.
You're most welcome.
It was wonderful talking to you, and thank you for
so
coming to our events. We're going to continue inviting you. So you can grab more little volunteer buddies.
Yes, volunteer buddies. That's what we're going to call them.
Okay. And we'll be back with more guests here on Mature Living. What a pleasant interview. I enjoyed it.
Thank you so much.